home on U.S. soil. Over 300 U.S. citizens are finally home after being in quarantine on the Princess Diamond over concerns of a coronavirus outbreak on the ship. However, the ordeal isn't over for 14 of those 300, who will remain under lockdown before they can get back to their families.
Late last night at about 2 or 3 this morning, we were asked to bring some individuals here, individuals who had either tested positive or had a high likelihood of testing positive because of symptoms they were exhibiting. All of these individuals, regardless of whether they test positive or negative on the test conducted today, will be here for 14 days. Those that test positive and are ill could theoretically be here longer than 14 days, but each of the individuals who arrived today will be here for 14 days.
Since its debut, health organizations around the world have been working to learn as much as they can about the virus in order to better detect and track its movement.
Today, China has published a paper with detailed data on more than 44,000 confirmed cases of COVID-19. This data gives us a better understanding about the age range of people affected, the severity of the disease, and the mortality rate. As such, they're very important in enabling WHO to provide good evidence-based advice to countries. We encourage all countries to share their data publicly.
China insists that the virus can still be contained, pointing to numbers showing a decline in new cases and releasing information about who is most at risk. But health officials are still calling for vigilance.
The data also appear to show a decline in new cases. This trend must be interpreted very cautiously. Trends can change as new populations are affected. It's too early to tell if this reported decline will continue. Every scenario is still on the table.
Even though China remains confident in its abilities, parts of the country remain under lockdown, including Wuhan, the epicenter of the outbreak. Meanwhile, many people with the virus remain in quarantine, waiting for health officials to find a way to outrace the virus before it spreads even further around the world. Lionel Donovan, TRT World.